A number of options for Canadian policymakers have been proposed to enhance pandemic monitoring through increased global surveillance and national zoonotic disease monitoring programs. Our group believes that policies related to the proposed options are likely to be developed in Canada, as there is significant evidence in favor of these options.
Currently in Canada, pandemic monitoring is done by the federally supervised Public Health Agency of Canada. However, global surveillance programs are scarce. Example of implemented systems are the HIV/AIDS surveillance program and the circumpolar surveillance system of invasive bacterial disease, which does not study high-risk countries. Adoption of the policy option would shift the status quo to increase global surveillance, where there will be more resources invested to improve international programs, especially in high-risk countries.
There are also few collaborative teams in Canada to conduct zoonotic disease surveillance. Flu Watch and the Centre for Foodborne Diseases and Environmental and Zoonotic Infectious Diseases attempt to understand the links between human, animal, and ecosystem health, but lack a unified system for routine zoonotic surveillance. The proposed element would attempt to create this unified national program and build off of systems currently in place.
In terms of government structure, both provincial and federal levels of government are involved. The former is responsible for coordinating the surveillance strategies and data sharing, while the latter is responsible for mobilizing their resources and implementing the changes. As such, this presents a case of marble cake federalism, where an agreement between multiple levels of the government is needed for a decision, thus lessening the likelihood of policy implementation. At the federal level, the Conservative Party holds a majority status, and thus does not face a veto point. However, veto points may exist at the provincial level. In Ontario, the Liberal Party faces a veto point due to its minority status. Nevertheless, despite this being a case of marble cake federalism with the potential for veto points at the provincial level, it is likely that parties at both levels of government would be in favor of these changes, as they can help alleviate burdens on the healthcare system in the long term.
With regards to policy legacies, this policy would not entail changes to Canada's core bargain, making it more likely to pass. Implementation of this policy would entail significant changes to the administrative framework, however. It would require a nationwide shift of data collection from written and institution or region-specific data collection to the electronic and nationwide synchronized systems. The Panorama project is one that has been devised to serve such purposes, with the aim of improving access to information and care for the prevention and management of pandemics. Although this project has yet to be implemented, the fact that it has already been devised helps alleviate the administrative burden associated with the change.
In this case, interest groups such as the Ontario Medical Association from the Pressure Pluralist Networks. However, the influence from policy networks is negligible in this case, as a change would not pose concentrated costs or benefits to any groups within pluralist networks.
When considering institutions in Canada, it appears that policy networks would lend support for this policy, while the effect of maintaining the policy legacy by governmental elites may hamper its progress. Government structures would also appear to slow policy development, although we do not believe it is a source of concern.
Several societal groups may support the proposed policies. For instance, First Nations and Inuit communities in remote areas have been affected the most by the H1N1 flu pandemic, suggesting that these groups would likely advocate for increased surveillance, as it would facilitate a better pandemic response across all jurisdictions. The Canadian Nurses Association, who play an integral role in all aspects of emergencies, would also be interested in having these proposals move forward, as it would help prepare them for future outbreaks. Therefore, these and other interest groups would support the proposed changes, improving the likelihood of policy implementation.
Ideas about what is in Canada are always shifting based on incoming research and reports. A recent study by the National Collaborating Centre for Environmental Health showed that surveillance approaches for zoonotic infectious diseases are less developed than for more traditional diseases, and that significant work is required in establishing routine surveillance to prevent future pandemics of influenza, West Nile, and Lyme disease. Systematic reviews have also been found supporting the benefits of establishing collaborative teams to conduct routine zoonotic surveillance.
In terms of what should be, polls of mass opinion show that 77% of Canadians believe that Canada should be recognized as an international humanitarian leader, strengthening the chances of a policy about global surveillance to succeed. Citizens have also shown interest in accessing information during a time of global crisis. For instance, the number of followers on the Centers for Disease and Control and Prevention's Twitter account increased from 2,500 before the H1N1 flu outbreak to 370,000 in late 2009 of June. These ideas all support the policy options being implemented.
Lastly, several external factors increase the importance of this policy. Namely, the 2009 H1N1 outbreak has provided the spark for much of the discussion regarding improving pandemic programs. Media coverage has also alerted the public of new influenza strains. These external events would increase the likelihood of the policy moving forward.
In conclusion, we believe the evidence in favor of increasing pandemic monitoring indicates that policies to increase global surveillance and national zoonotic disease monitoring will be developed within Canada. After analyzing the FREI framework, we are confident that the evidence for the development of these policies is largely positive and few counter-arguments exist. The small number that exists are also likely irrelevant, as such programs would provide widespread benefit but only diffuse costs for all.